Okay, folks, we're going to get started now. So we're very excited about our webinar today, mobile research apps. And we're going to talk about how leading universities like Stanford, Johns Hopkins, Rochester, etc., are mobilizing research data collection. You know, of course, all of this stemming from the work that Apple has been doing with ResearchKit, but really a lot of other developments going on that are making this area a really exciting opportunity for really resetting the way how research data collection has happened. So I'll get started, and just a logistic thing. If the webinar video is appearing pixelated, please use the settings tab on the bottom right to increase the quality of the webinar. You can change the pixel resolution. And if you have any questions, please use the Ask a Question section below the webinar video. You can also tweet us at TrialX or hashtag RKWebinar, and we will be there to answer questions in the QA section of the talk today. So just a little bit about us, so that you get the context about who we are and why we are so excited about ResearchKit and what we are doing here at TrialX. So we are a company that connects patients to research. We started in 2008, building apps to connect patients to clinical trials on the patient health platforms of Google Health and Microsoft Health World way back in 2008. You know, there was this whole revolution that was envisioned by these two companies, that patients could access the medical records online, and then there could be apps that could do useful information with that record. And then over the time, building solutions that are being used at University of Pennsylvania, Beth Israel, NYU, etc., to really help with patient recruitment for clinical trials. But in the last 1.5 to 2 years that since ResearchKit has come out, we have really focused our effort to see not only that how do we connect patients to trials, but how do we actually enable researchers to collect data using smartphones. So that's our history, and that's what has led us to where we are right now as a company, developing tools for you to collect data from patients using smartphones. So myself a little bit, I'm the CEO and co-founder here at TrialX, and also on the talk today, managing some of the technical demonstration that we'll be doing is Chintan, and also supported by Nick on our end in the mobile development team. Chintan leads all our technology efforts, and he's a CTO and co-founder at the company. So quick outline. We're going to talk a little bit about ResearchKit key capabilities. A lot of people who have signed up today probably are already familiar with ResearchKit, but just to set the agenda so that people can get a little bit of background on what this library does. And then we'll actually discuss some case studies of apps that came out in March 2015, and then see what their success and challenges have been. And then a lot of you might be wondering, how do you get your own app? And we'll talk about what we are doing to get researchers an app in literally no time. And we'll demo that to you today, and then open it up for some Q&A. So ResearchKit, it's an open source framework introduced by Apple, March 2015. That allows researchers and developers to create powerful apps for medical research. At the time when they launched, they had these 5 apps: the Empower study at University of Rochester, Asthma from Mount Sinai, and the Stanford My Heart study, and a couple of others from UCSF and Mass General Hospital. Very exciting. This announcement was so key in really pushing the agenda of smartphone-based research out in the forefront. And it was exciting to see that some of these leading universities were the initial partners that worked on the platform and launched when ResearchKit was launched officially. Since then, there has been a lot of activity. This is just an infographic that summarizes some of the apps that were launched in 2016 itself. And more than almost 3 dozen apps are there right now. I mean, unlike the App Store where millions of apps are there, having said that, because these are research-focused apps, it's still a tremendous opportunity here to see that how the uptake has happened, and universities are thinking of such research apps. So what can you do with ResearchKit? Very quickly, you can create pre-screeners. As you can see here on the left side, you can ask any number of questions to pre-screen your audience. You have a whole library, and this is where I really hats off to the researcher at Apple. that they have really simplified the consent process. And my background being an MD and in the research world, consent was always one thing that investigators and patients have struggled with. Long PDF documents, get them into the clinic, and then have them sign, etc., and manage all this information. So this has all been simplified here in Apple ResearchKit in the screen by screen, and I'll show some of that to you. Patients can even sign the consent right off on the phone itself. And then you have all the capabilities to create a bunch of surveys, and including surveys with icons as responses. And furthermore, because of all these phones now having sensors and Apple launching HealthKit in 2014, I believe, being able to collect patient data that is being generated from sensors and wearables. And what I personally feel is exciting and is a ripe area for research is that all this time research has pretty much been a one-way street, where the participants keep collecting data for the research teams to then analyze and then publish. But the participants rarely get to see the data or understand the data. But with these apps now, you can give them real-time feedback as to how they are doing compared to others, how much they are walking, how much they are scoring, and how much the whole cohort of patients are doing. So that, I think, is a powerful motivator to have your audience be engaged and participating in your research study, which is very, very exciting. What else beyond that, which is a great addition to ResearchKit by default, which ResearchKit doesn't come with integration to all these wearables, but that wearables are very popular, with Fitbits and Withings and Misfits, millions and millions of users globally. What we have done is that actually our partner Get Health has built an API that can integrate through all these wearables and collect all these wearables. And I think this was probably the toughest tongue twister I've ever had in my life, wearables with a W and wearables with a V. And you can now integrate all of this into your apps that using a platform that we will demo to you later towards the talk. So that was the introduction to ResearchKit. Now, how has it been used? And what are the early results? So we'll discuss some case studies, Stanford, University of Rochester, Mount Sinai's Asthma app, and John Hopkins EpiWatch app. The My Heart app of Stanford University, the focus was, give some cardiovascular health risk assessments and give some users the feedback and let them know their risk for cardiovascular disease. And there was pretty good uptake, like almost 50,000 people downloaded and consented. And so as you can see here, almost 7,000 people reported that they had a disease. And furthermore, almost half of them reported they taking a medication. They completed daily surveys. They did a 6-minute walk test. And this was one of the largest data collections within weeks and months of cardiovascular assessments and risk determination, just using the iPhone app. Then this success was that they were able to demonstrate that you can consent large numbers of people. You can consent a lot of data quickly. And they actually even correlated some of this data to see that how accurate it is. And they are finding some early positive indicators that the data collection is robust and not entirely insignificant. And the problem was that, and we know this is a problem with smartphone research right now, especially with ResearchKit, is that the population is skewed. They've got a predominance of male participants and younger participants in the mid-30 age group, which is not necessarily at risk for cardiovascular disease immediately. And then they also found that there was rapid drop-off in engagement over time. And we have seen that these two are the major limitations of smartphone-based research. But having said that, and we'll discuss this later, that there are ways to address these limitations. And some of those we are trying to address in our platform as well. The other is a very exciting study on Parkinson's disease from University of Rochester. Again, one of the initial apps that came out when ResearchKit was announced in 2015. And this app basically tracks Parkinson's symptoms. And it actually even uses the active tasks of ResearchKit, where patients can hold the phone and it uses the phone sensors to see if they're having any tremors or not. And that, I think, is a very, very clever use of the phone. And they again got so for some reason all these guys got these numbers in 48,000 to 50,000 range, which is very exciting. I don't know if they use the same marketing company or same push to get the downloads. And then almost 16,000 participants consented to participate in the study, and there was a drop-off. So, but still, almost 1,000 participants contributed data for more than 5 periods in the study, which is a lot, given the fact that in Parkinson's disease, getting granular data about symptoms and tremors, etc., is not possible with your day-to-day paper surveys that, or tracking through phone or interviews or electronic health records. Participants walked, they did tapping tests, they did memory tests, did some voice activities and surveys, and provided a rich set of data from these 1,000 participants to the research team. Again, the successes have been that they were able to collect data about tremors, about surveys, about symptoms. Challenges, again, were drop-off after the initial download, and there were some inconsistencies in what the data was being reported and what actually was the outcomes. So those are some of the limitations of this study. The asthma health study, really recently, the Icahn School of Medicine at Mount Sinai, they're also one of the initial apps that came out in 2015, and it's an asthma health tracker. And they just released some of their data in a paper recently. And the app allowed patients to track and review their asthma symptoms, including location, so they could see where people are, and if any pollutants like nitrogen dioxide, etc., the levels of those pollutants could correlate with the symptoms that patients were reporting. And very, very interesting, they actually correlated the symptom data with a wildfire in Washington state. And they actually found that people in Washington state were reporting a slightly significantly higher, statistically significantly higher asthma symptoms when the wildfire was going on. Very exciting, very exciting. This tells you the power that smartphone, because the size of participants can be so large, that even if at the individual level the data is not very consistent or has some biases, you could still get some meaningful signal out of the large sample of data that you're getting. And then they also even gave personalized reminders so that participants could take their prescribed medication and also share the information with doctors. This is a very exciting study, and I think the Mount Sinai folks are now going to UK and other places to expand the reach of the study. Some numbers again, this magic 50,000 number. So I think all the ResearchKit apps are looking at the 50,000 magic number, and in the same amount of roughly 8,000 people completed the consent. But in this case, compared to the Empower study, they actually had 22,300 participants who did a lot of surveys, multiple surveys, and logged their symptoms on more than one occasion. So if all of you are having any difficulty with resolution, please do look at your stream and check the pixel size so that you can get a higher resolution on your end. The success and challenges of the Mount Sinai app: great reporting of asthma symptoms, being able to correlate that with external factors because they were tracking GPS and latitude, longitude. And then 85% of the people actually completed more than one survey. Again, there was drop-off, and again, there was reporting and selection bias. And all of you probably already know this. Why is there bias in these studies? And part of it is because ResearchKit only runs on iOS. So you're essentially excluding 60% of the people. So some people have submitted a question that there's some problem with your audio. So I think what you need to do is go to your video and go to the settings, and in that enable the quality so that you get better audio and better resolution of the image. So choose 400 pixels or something low so that if your internet is not very high, you can get a better quality of the image and audio. Then last study, without belaboring you with a lot of data, and I think another great use case of technology is the Apple Watch study. They have actually taken it beyond the phone to the Apple Watch. You actually could participate in this study only if you had an Apple Watch. And they were tracking the prediction of an oncoming seizure by the movement of the sensors in the watch. And I think this is fascinating stuff. Uh, um, the They were able to then see if there was an onset of a seizure, and after the seizure also assess what were the triggers, and also even inform caregivers if there was a serious there was a high risk of a serious post seizure outcome. So very exciting. 1,500 seizures were tracked. Well, so almost 40% of the participants who consented and joined the study were able to track 1,500 seizures, and um, they were able to even report triggers of what triggered the event. And the data shows that stress and sleep. Now we all know that stress and lack of sleep has been, like it has been known as a trigger for seizure, but now you're actually getting it at the time when it's happened. The patients are reporting this rather than 1 month down the road when they visit the doctor, and then the doctor asks them, okay, what could have triggered it, and they're trying to recall it and are not able to give the accurate description as compared to recording it right after the event. So very exciting, and I think they are going to share the full results in a conference, a neurology conference in Boston soon. So we don't know all the details yet, and that's why I included this at the bottom, because the early results are very promising, but we do need to see what else were the challenges that these researchers faced. We will very quickly, without beating our own horn, add some details of two studies. That one of them is the walking study. We actually did our own TrialX, did its own study last year called the America Walk study. And the reason why I mentioned this is that we address the limitation of sample bias by actually building the entire Android equivalent of ResearchKit, and then another study app that we have developed for Columbia University called Fender. So very quickly about Apple, the America Walk study. We wanted to just see very simply how much people walk across the country. The recommendation is 10,000 steps a day, but it's known that through pedometer studies and surveys that Americans on average are walking around less than half of the 10,000 recommended steps. And the other thing we wanted to demonstrate that can you build an app that runs on iOS and an Android? And resoundingly, we succeeded in that, though it was a lot of effort, and we'll talk a little bit about that. We got, for over 10 months, we got 200 plus participants with 22 million steps walked from 35 states and 130 cities, and almost 300 days of data, with almost 8,000 steps walked here by participants, which is better than what the average American walks. But again, this could be because smartphone users that we had were a bit more active people. We succeeded in two things, very importantly. We succeeded in engaging 63% of our participants over the 30-day study period, which is a significant improvement over the drop that has been experienced by some of the other apps. And we were able to demonstrate that you can have an app that's not, pretty much the same, but running on iOS and Android. The complexity of managing device differences in Android was a major challenge, and our engineering team had to pretty much port entire ResearchKit into Android. And we have this library called Research Droid that you're more than welcome to ping us after this, which we can tell you more about. Fendo is an app we have developed for Columbia University. Early days, the research is going to, publications are going to come out very soon, but it's the first app to track endometriosis symptom, has received a lot of interest from the community. More than 1,500 participants have already joined, and it was featured in the ResearchKit blog last month as the featured app in February. Very exciting, very excited about it, and looking forward to the results from this study. Now comes, what are we doing and how can we help you get an app? So you saw the possibilities of ResearchKit. You saw what people are doing at these leading organizations. And if you are wondering how to do your own study app, this section will address the how we can get you an app quickly. So what are some of the challenges that we have seen and read about and heard from some of our clients as well is, development is really time consuming. You're looking at 4 to 6 months easily just to get an app ready. And it is, if you just use ResearchKit, you're only going to get Apple users, which, as you can see from the early data of the 4 studies, is a limitation. You are going to buy a sample, and that has to be addressed, because half the population or more is using Android, and globally even more. So if you want to take the studies global, you really have to consider the Android option. And then cost is a significant barrier. And don't take our word for it, but you can actually, there is a really cool website which allows you to calculate the cost of an app. And if you just look at, very simple app with icons and some other, few features, you're simply looking at, $75,000 to $100,000 to build an app. And, a lot of research budgets don't support this kind of development and projects. So we thought a lot about it, and coming from an informatics background, coming from a medical clinical background, and in the technology industry, we brainstormed this and we said, how can we make the physician, the clinicians, the public health researchers with $5,000, $10,000 budgets go and have an app tomorrow? So we have built App Bakery, and we said, why do you need to build and code when you can bake an app? And this requires no programming. You get an app that runs both on iOS and Android, and you build your app through a web wizard, and you press a button, you go get coffee, and you will get an app that runs on iOS and Android. And we'll show that to you in a little bit. And you don't pay a dime till your app goes live on the App Store. So with that, I'll quickly jump into, this is our App Bakery page. We're going to turn the whole world from eating cookies into baking apps. And all the clinicians are going to get our limited edition baker's hat very soon as they start baking their apps. As I said, some of these features, no cost. You can do it yourself. You can use the web wizard. And I'll quickly jump to the demo. So you come to App Bakery. You get started by putting your email, name, and some basic information. Then we'll send you some follow-up information to get you started. And then when you